Have you ever wondered how some women in the world are able to successfully carry enormously heavy loads on their heads with ease, while over 80% of Americans seek help at some point for the relief of back pain, often with poor results? This wouldn't be so surprising if we could blame this on a sedentary lifestyle. But in actuality, millions of people in our country injure themselves each year while exercising and playing sports. Even someone who is fit by our current cultural standards can struggle with recurring back and other pain problems. We may never have any reason whatsoever to carry heavy loads on our heads. Yet those women who do this successfully, sometimes day in and day out for decades, hold the secret for how to live free of back, neck, and joint pain. Each one of the women pictured here has never lost the same natural skeletal alignment she first discovered as a toddler. When a baby is able to stand and walk, it is because he or she has figured out, through trial and error, how to organize the skeleton so that each weight-bearing joint, ankle, knee, hip, and shoulder, the yellow dots here, stack up along the vertical axis of gravity or plumb line. This is the natural human design that provides a whole lifetime of pain-free flexibility, authentic strength, and enduring vitality. This also explains how a heavy load on someone's head can be easily distributed through this solid, vertical line. The pelvis is the foundation for all that rests above it. At the back of the pelvis is a triangular-shaped bone called the sacrum. At the top of the sacrum is a small platform on which the spine sits and from which it stacks itself up along the vertical axis. The angle of the pelvis and the sacral platform determines whether or not the spine can be a mostly self-supporting structure or whether muscles will have to work to hold the spine upright. This X-ray of a healthy baby's spine shows the symmetry of the vertebrae and the open space between each one. The intervertebral discs, which don't show up on this X-ray, cushion each bone of the spine. Nerve roots from the spinal cord pass through openings in the spine, transmitting messages to and from the brain. The spine of a healthy baby is elongated, without compression on discs or pressure on nerves. Although healthy babies everywhere in the world discover for themselves how to align the pelvis and spine, many people lose the support of the pelvis at an early age. This is a common problem for children today and has serious long-term consequences, bringing new meaning to the adage, "You are only as old as your spine." Those who are fortunate to never lose the support of aligned bones enjoy the benefits of a youthful spine throughout many decades. Babies move by bending at the hips, all the while maintaining the integrity of a long, open spine. While exercise offers many obvious benefits, movements are often done that cause repetitive compression to the spine, either by arching it while bending forward or by arching it the other way. Such movements are the cause of many of the injuries people experience while exercising. Something as benign as sitting, which most people do for hours every day, often causes chronic compression and contributes to degenerative conditions of the spine. Even walking, which is considered almost universally beneficial, if done with a lifted up chest, can cause spinal compression with each and every step. The human skeleton is the framework of support for the body, much the same way that posts and wall studs are for a house. Both houses and human bodies are governed by the same physical laws that govern engineering and architecture, and require that upright supports align along the plumb line. A look at scaffolding helps us understand just how essential vertical alignment is to the stability of our joints. In some places, scaffolding is constructed of bamboo poles lashed together. If the upright posts are not vertically aligned, considerable stress is put on these joints. This might help explain the epidemic of joint replacement surgeries in technologically advanced places in the world. Chronic misalignment puts stress on the ligaments that stabilize and lash the joints together and cause cartilage to deteriorate. This woman stands in a familiar state of collapse. Her pelvis is tilted backwards or tucked under, causing a rounding in her spine. Her legs do not serve as pillars of support for the body above them. It's not uncommon in our culture to see many variations of this same theme of structural collapse. In our attempt to counteract this kind of slouching, modern culture has developed what is typically called good posture, with instructions that are familiar to almost everyone. Suck in the belly, lift up the chest, and pull the shoulders back. This unnatural stance, which is commonly seen in military exercises and many yoga classes, takes a lot of work to maintain. It throws the weight-bearing joints off the vertical axis. Having an aligned pelvis makes it possible for the body to be supported by a natural interplay of aligned bones and elastic muscles, allowing the spine to be free of compression. It is far less common now than it once was to see people, regardless of age, size, or shape, inhabiting their bodies in this natural way. This, of course, turns out to be the secret for pain-free living that women who successfully carry heavy loads on their heads demonstrate so clearly. We never need attempt such a thing ourselves to still get the benefit of learning how to align our bones from these women. By adding a view of skeletal muscles to these three models, it becomes clear just how distorted muscle fibers can be, some overly contracted, others overly lengthened, when the bones they attach to are misplaced. This essential information about truly natural skeletal alignment is missing from the curriculum in medical schools. It is largely overlooked in training programs for physical therapists, physical education teachers, yoga and fitness instructors. This is particularly unfortunate, since healthy functioning of vital organs and such bodily systems as digestion, circulation, and respiration are affected by our posture. While it's certainly not a quick fix, after all, there is no such thing, we can relearn how to sit upright with ease, how to lengthen the spine while leaning back, as one might do while driving a car, how to stand with the solid support of aligned bones, and to once again walk like a toddler. We can learn how to bend like a baby, or this 93-year-old woman who never lost her natural alignment in the first place. We can learn simple details for how to safely exercise and practice yoga. Once we relearn the original rules, we can leave behind moving in ways that cause us pain and rediscover the natural ease and freedom of movement intended by our human design.